then you can start bathing in it. If you try to test it with your foot and you're neuropathic, which means you don't have normal sensations, then you may burn your feet when you get in there.
I see what you mean. Yeah, that makes sense.
Anyways, not only are we encouraging calls on this show, but Podiatry is having a podiatry call-in day in November.
We do on November 19th from 8 to 4. Volunteer podiatrists from Illinois will be staffing a phone bank here in Chicago. You'll be able to talk to a podiatrist about any foot-related problem you have, whether it's diabetes or not. Last year we did see about 25%, tracking the statistic you mentioned, about 25% of the calls we got were from people with diabetes, which I thought was interesting. But there'll be volunteer podiatrists standing by to answer calls, provide referrals to podiatrists in your area. You'll get 2 or 3 podiatrists in a zip code near you, and you'll be able to go and make an appointment with them if you have a specific question that we can't answer over the phone. Okay. So look for that. That's going to be November 19th. That's a Wednesday. And again, from 8 to 4. We'll put up the number here. It's 888-869-3338.
Okay.
I wanted to talk to you about there's been a trend, sort of a movement in podiatry, and it's caught on to regular medicine because I saw this in my son's pediatrician earlier this year, encouraging people to take their socks off during just general checkups.
Absolutely.
Go into a little bit more detail about how podiatrists started that and how that sort of caught on to the regular medical community.
Well, the problem is people go to their internists, they get a regular physical. Many times the internist just doesn't take off their socks. Mm-hmm. And like we said before, the early signs of diabetes can be seen in the foot. So we ask every time a patient comes to or goes to their internist, their family physician, that they ask the physician to inspect their feet. Mm-hmm. So that will be that can be the beginnings of where diabetes is diagnosed. Obviously, the people that come to podiatrists, since we do foot and ankle, we examine them all the time and we pick these people up.
Sure. So you were talking about some of the do's. Why don't you cover some of the don'ts that sort of track with diabetes as well?
Well, what we ask all our patients is please never to walk barefoot. Mm-hmm. The problem with that is, as walking barefoot, they can open a sore in their foot, rip open the skin, and cause an infection. Okay.
We have our first caller for the night. Go ahead, you're on Feet Forward.
Yes, I was calling because I'm a type 2 diabetic, and I always get athlete feet.
Mm-hmm. Yeah.
Now my sugars are under control in my feet, and I'm having athlete feet again.
Yeah. Unfortunately, athlete's foot likes to grow in a dark, warm, moist environment, and what athlete's foot is, it's a fungal infection of the skin, and the foot is a perfect spot for it. People who are diabetic, I find a lot of times have athlete's foot, and like I said, it's a fungal infection of the skin. We also have fungal infections of the nails, where the nails become thick, discolored, and brittle. And the same fungus that causes athlete's foot is the same fungus that causes the nails to become thickened. So, are your nails thickened at all, or is it just does the fungus only involve the skin?
It's only on my skin.
Have you tried some?
Between my toes.
In between the toes? Well, what you should do, there's a lot of different topical medications out there in the drugstore. I would try some of those, and I would be consequent about utilizing them twice a day. I also make sure you dry your feet, wash your feet at least once a day, possibly twice a day, dry between the toes, and then utilize the creams, not the powders, but the creams twice a day. You have to be consequent using it for about a month. If that doesn't take care of it, then you should seek a podiatrist out. The other thing I tell you is to make sure that the shoes that you wear breathe, and the socks that you wear breathe. If you sweat excessively, make sure you change the shoes and the socks at least once a day. Thank you for your call.
Thank you.
Anyways, we were talking about some don'ts. Mm-hmm. One of the things that I really encourage many of my diabetics to do is to really stop smoking. Mm. One cigarette causes the blood vessels to constrict the lower extremities for 1 hour. Mm-hmm. The problem is a lot of our diabetics are now over 60 years old, and there's a high preponderance of people smoking at that age. And as the diabetics come in, not only are they vascularly compromised, which means they've got poor circulation, but now they're smoking, and that's just not helping at all. Right. So I ask all of my diabetic patients, if possible, to stop smoking.
Yeah.
Ask them to avoid utilizing any acids on their feet. A lot of times people utilize acids which are in corn removers, and they figure, well, I'm going to put this acid on and that it will burn the corn away. The problem is the acids burn through the corn, burn through the skin, and we have an ulcer and thus an infection.
Great. We have another caller. Go ahead. You're on Feet Forward.
Yes, I have neuropathy in my 2 feet. Now, I see in the newspaper there's this clinic that claims they can reverse neuropathy by putting some sort of light on your feet. Or well, I want to, is that crackery, or can neuropathy be reversed and healed? And also, what are some of the non-clinical things I can do to help my neuropathy?
Well, the most important thing is keep your sugar under control. That is the most important thing. Now, when the small vessels start closing up in the foot, and I told you that it provides poor circulation, also the nerves start dying, and that's why we get neuropathy. What can you do about neuropathy? The first thing we can do is put you on some medications, either something called Lyrica or Neurontin, which help slow down the pain from neuropathy. It won't ever reverse it. What you're reading is called anodyne therapy or infrared therapy, and what that does is it increases microcirculation to the nerves and actually can help the neuropathy. What I would recommend, the units are expensive. I would recommend maybe going to a podiatrist who has a unit that you can try. The unit, you have to utilize it about a half an hour a day, and many of my patients get it. It costs about $1,000. Use it about a half an hour a day. I tell people when you watch the news, just put the unit on. It doesn't hurt at all. 50% of the people do fabulous with it, and some people, it doesn't affect them at all. But I would definitely have it checked out.
$1,000?
The unit's $1,000. But the nice thing is you don't. It's a lot of money, and I understand that. But if it's going to save your limb, it's worth every penny you pay. Also, what's nice about that unit is you don't have to buy any extra pads, any creams, any electrodes. The unit is about $1,000, and it's all inclusive, and you shouldn't have to replace any parts. So it should last you 5 years or more. So $1,000 over 5 years, it's $200 a year. It's less than $1 a day to save your legs. It's pretty good.
Okay.
Thank you very much.
Thanks for your call. We have another call. They're lining up. Go ahead. You're on Feet Forward.
How you doing? I'm a diabetic.
How are you? What can I do for you?
My feet ache, but they only ache when I.
Oh, they only ache when you run?
Well, you may have that pain may not be associated with diabetes. Do you have flat feet at all? Well, it could be that you have flat feet. And what happens? I have a skeleton nice in hand here. When someone has got a flat foot, the arch stretches out, and as a result, it can cause much achiness in the joints and in the muscles. What I tell people at that point is to try to get a good supportive shoe. If a good supportive shoe helps but doesn't take total relief away, then I recommend something like an orthotic, either a custom support or an over-the-counter support. Many different types of devices out there that can help, and if you can support the arch, many times the pain goes away.
Okay, thanks for your call. We have another call.
Can I help
you?
Go
ahead, you're on Feet Forward.
Hi.
How are you?
I have heel pain. Do you know what? I mean, I'm not diabetic or anything that I know of, but...
No, that's very common. It's probably the most common thing that brings people into my office is heel pain. Do you have pain when you get up in the morning?
No.
No? Is it just as you get toward the end of the day?
Right.
Yeah, it's called plantar fasciitis. Plantar fasciitis is inflammation of a ligament on the bottom of the heel. This ligament runs from the